Hello, and thank you for checking in to our ACANY and Life Plan virtual learning session for April 21st, 2026. This is Home Enabling Supports. In this session, presenters Ronak Parikh and Tracy Picard from the ADAPT Community Network introduce Home Enabling Supports, a new HCBS waiver service designed to help people live more safely and independently in their homes. It explains how the service works, what individuals and families can expect along the way, and how care managers and providers support access to technology and services that meet each person's needs. Throughout this presentation, you will learn what home enabling supports are and how they help people live more safely and independently at home, who is eligible for home enabling supports, and how the service fits into the HCBS waiver, the types of supports available, including assistive technology, remote supports, and health coordination services, and how to get started, including the referral, assessment, and approval process. This presentation is ideal for members and families, care managers, and professionals supporting people with intellectual and developmental disabilities in New York State. We hope you find this session informative and useful. Let's get started. And with that, I'm happy to introduce our presenters from ADAPT Community Network, Ronak Parikh and Tracy Picard, and I will pass it to them to introduce themselves a little bit more.
Thanks, Kate, and thanks for having us. Hope everyone is having a good day. So I'm Ronak Parikh. I'm the Senior Vice President of Community and Business Development at ADAPT Community Network. I've been at ADAPT for almost 3 years. Prior to coming over to ADAPT, and my role here at ADAPT is looking at new opportunities for us to grow, diversify, do things more innovatively, be more efficient, support different departments and doing new things, different things. So I play a lot of different roles. And one of the roles I've been playing recently is to try to, develop and implement this new home enabling support service at ADAPT. And Tracy will talk more about, the background about the program. And one thing, for the folks from ACA and Life Plan, my previous role before I came over to ADAPT, I was a consultant at a boutique healthcare consulting firm. And ADAPT was one of my clients for about 14 years, so I know the industry quite well. But also, Advanced Care Alliance was one of my clients. Actually, was one of the part of the group that actually founded and established Advanced Care Alliance before they became a CCO, and then supported them during their transition to become a CCO. Also worked with Life Plan after they became a CCO and worked on coordinating the partnership between ACA and Life Plan, during that period about, I forget, it was 6-7 years ago. But so I have a lot of history in the IDD world here in New York, both on the CCO side and the provider side. I'll turn it over to Tracy to give a little bit background on herself.
Hi, good evening, everyone. I'm Tracy Picard. I'm the Vice President of Family Support Services at ADAPT Community Network. I've been at ADAPT, it'll be 5 years this summer. Prior to working at ADAPT, I've worked at the Cerebral Palsy Foundation, the Weinberg Family CP Center, which is at Columbia University Medical Center and Hospital for Special Surgery, working with families and working with people supported. At ADAPT, I oversee all of our family support services programs, which I'm sure many of you are familiar with what they are. My background is in social work with a concentration on management and health. And we can go on to the next slide. So this is just the outline for what we're going to be going over today. The overview of the program, like what is home enabling supports, how are you eligible, what are the goals, the processes. So, how does it work in terms of, getting the services, what is the assessment tool, contracting with vendors. So you're going to hear specifics on which vendors we have contracts with, what they provide, and then the current implementation status, as well as next steps and key takeaways. I would encourage you, if you think of something like a question that comes up while we're talking, feel free to put it in the chat. We will have time at the end to address them. So you can go ahead, next slide. So the overview. So, what is home enabling supports? It is a new service that OPWDD announced. There are 8 service providers throughout the New York State that provide services to people with IDD who are living in the community. I'm going to go over the specifics of eligibility, but just generally, you have to be enrolled in OPWDD and the HCBS waiver. And, the goal is really to ensure that people are able to build or keep important life skills, improve communication and relationships, stay as independent as possible, and be actively involved in their community, and also less reliant on staff. So if you want to go to the next slide. Again, this is a subcomponent of the assistive technology category of the HCBS waiver services. We're going to talk how it fits into that in an upcoming slide. This is a very streamlined authorization process that we're also going to take you through step by step. How families, how people supported can get approved for these services. The services are billed directly to Medicaid, both in choices and using Medicaid billing system integration. And each provider, each of the 8 providers provide an assessment. They work closely to help acquire the service or the technology or the device. And then they also, depending on if it's a service that is ongoing, they're involved in sort of that ongoing management piece, and they're to assist. So you can go to the next slide. So the next one. Yeah, great. Thank you. So the goals, as I mentioned, really they're increase, maintain, and improve several goals. So to be independent in the home, to improve safety, improve health outcomes, improve community participation, and minimize reliance on assistance or supervision. So, you can think about it as, the idea is to make sure that people are safe and healthy as they can be in their home, that they can participate, and that the device or the technology will help minimize the number of people, whether it's a family member or staff that need to assist them. You can go on to the next. So the eligibility criteria have to be enrolled in New York State Medicaid and the OPWDD HCBS waiver. You have to live in a community and a non-certified residence. Remote support services, which we're going to talk a bit more specifically about what those are in some upcoming slides, are limited to people ages 15 and older. However, those that are younger than that are still eligible to participate in the program. They're just not able to get remote support. They have to have identified goal or need added to their life plan. And we're going to talk a bit about that process too as we go forward. Next slide. So there are 3 categories of the types of services that are being offered. There is assistive technology, there is remote services, and HACS, which stands for Health Assessment and Coordination Services. So these are the 3 buckets, and I'll go into some detail about this, but we will be providing very specific examples a little bit later in the presentation. So assistive technology, I'm sure most people on this call are familiar with what that is, but devices that are designed to assist a person perform a particular task, but they don't involve real-time in-person support. So Some examples are medication pill dispensers, smart home automation, software applications, such as meal prep, fitness, home security, and safe cooking applications. Remote supports are provided, and we're going to go through the vendors that we have contracts with, but it's services provided through a vendor subcontract, and the vendor is located in a remote location, and they can engage with the person in two-way communication. It can be done as needed, as scheduled, on-demand check-ins, and that vendor is there to really help, assist with the setup, but then also, troubleshoot. And, if the person is maybe just like not using the device or using the technology as much as they could be, they can provide some assistance there. And then for the last category, for the hacks, this is 24/7 consultative telehealth service that provides real-time consultation. So we're going to talk specifically about which vendors, but the idea is that they can help identify the next steps really needed if the person is undergoing health issue, and that might be a referral to a local emergency department or urgent care. It could be that, nothing is really needed at that time, but it's really having that service consultation available. The one caveat is it can't duplicate or replace any other HCBS services or medical services. And it was a lot of information. We're going to flush it out for you going forward. All right, next slide. So these are what are excluded. Items of general utility. So something that everybody, in the home uses. We had a question on the last call. Can, we provide internet? We can't provide internet. Durable medical equipment. So anything that could be covered by another payor, we're not allowed to include. Recreational devices, so devices that are used to play games, experimental devices, so newer devices that haven't been approved. Therapy and emotional support animals are also not allowed, and devices used for surveillance purposes. So that's considered like one-way camera surveillance, and that would not be included as well. Next slide. So the funding structure, it is limited to $5,000 in technology and services per person per year, which is within the broader $25,000 assistive technology per 2-year period allowance. And just to say too, because it's also come up, you can request multiple services as long as you don't exceed the $5,000. What is included is assistive technology, subscriptions, and remote support. And this $5,000 does not include the administrative fee that is paid to the HES provider. Next slide, please. So here you can see the service provider network. There are providers across the state of New York. As I mentioned, there's 8 providers. ADAPT is sitting in the 4th catchment area along with 2 other providers. But the other thing is we will provide, after this presentation, we're going to be putting together a contact list so that if you look at this map and you determine, where you will need to get those supports and services, who would be the agency to reach out to. So that will be forthcoming. Next slide, please. And I'm going to turn it over to Ronik to continue with the presentation.
Thanks, Tracy. So I think, big picture, this is a new Medicaid waiver service. I think, that the benefits of this program in comparison to what was available previously, I know the assistive technology service under the HCBS waiver was available and is still available going forward. But this new program is a little bit more streamlined in terms of getting people access to technology. There's a more straightforward way of adding the new service into a person's life plan, getting it approved, and we'll talk about that in a little bit more detail. Getting it approved by OPWDD, and then the HES providers supporting through an assessment, matching up people with technology that meets their needs and their goals, and aligns with their desires. This the mechanism by which this is a direct Medicaid funded service, whereby we as the HES providers can bill for this service directly to the to EMED, the Medicaid program, and get reimbursed, is a little bit more straightforward than the old model, which is still available, where there's a back and forth with OPWDD. We have to get bids, we have to do the assessment, get bids from technology vendors, and then get that approved, and then there's a back and forth review and approval process. This kind of streamlines it. So the goal is that there'll be quicker and easier access for people to get access to various technologies and services that support them to live more independently. And we think this is just the beginning, and we'll talk about some of the technologies that we're planning to make available during launch. And that's only the starting point. We think that there's going to be a lot more in the future, and we're going to hopefully get some feedback from care managers, individuals, family members, and others about things that people want, so that we can start making that available in the future for this program. So yeah, I think we can go to the next slide. So we kind of this is not, even though it's easier and seemingly more streamlined than the original assistive technology service, there's still a lot of different stakeholders involved and a lot of different processes that we have to make sure that we're aligned on with all the various stakeholders to ensure that people understand and set the expectations about this is not going to be like you want access to technology and you get it next week. There is a little bit of a process involved, and so that it starts with the person-centered life planning process, and that's something that is handled by the CCO care managers. So life plan CCO care managers and ACA CCO care managers that are on this call. This is where you guys are going to be instrumental in providing education and support to individuals to understand what's available and how to get access, and then support them to submit a SART to the OPWDD DDRO to apply for this new service, and then the DDRO will review it and then hopefully approve it. Once they give the authorization for the service, or if they don't, our understanding is that the CCOs have the opportunity to go through the appeal process, similar to what they do for any other service that gets denied by the DDRO. So that's not going to be any different from compared to any other program or service that's available through the waiver. But once our understanding is that once the DDRO approves this service and authorizes it, then the CCOs can then refer the individual to one of the 8 CCOs, or specifically one of the CCOs in that person's geography. So just like Tracy said, in New York City, Adapt Community Network is one of the 3 HES service providers. So an individual could get referred to us if they're living in New York. But there's also 2 other choices. They can get referred to the Center for Family Support or Person-Centered Care Services in New York City. And in the other regions, in Region 5 in Long Island, there's 2 providers. In the Hudson Valley, in Region 3, there's 2 providers. And then in the northern tier that kind of wraps around to Central New York, Region 2, there's 1 provider, and Western New York, there's 1 provider in Region 1. So once it's approved, then the CCO can then refer the individual to one of the HES providers. And one of the things that we are doing, we haven't done yet, but we're going to be doing in the very near future is provide not only contact information for all 8 HES providers. So you have each CCO care manager has, basically a cheat sheet of all the different service providers that are out there, but also provide information about what kind of, almost like a referral, tracking document to, be able to provide specific information on an individual during the referral, so that we can get, the right level of information to be able to more easily connect with that individual, start the process of coordinating an assessment, and then, working with the individual to get them access to the technology. So that's something that's going to be forthcoming. I know we've already had initial conversations with most of the CCOs about the types of information that would be helpful, but we have to just nail that down and then provide that to the CCO so that we can make sure that it aligns, and we can get that information in a standardized, easy to access way. So once the individual gets referred to the HES provider, then the ball is in our court to coordinate and do the assessment. And our goal, we have an assessment that we've developed, and it takes, give or take, about 45 minutes. So we don't want it to be too onerous, too long, but we want it to be comprehensive enough so that we can then use the information from that to then match people up with technology that addresses their needs, meets their goals, and make sure that it aligns with their desires about what they want and how they want to live their lives, and to be more independent, to be safer in their home environment, to be more included in the community, and all those other goals that are set out for this program. So once we finalize the assessment, make a recommendation on the technologies that the individual could get through this program, then we would work on developing an HES plan and make sure that the technologies and services that we include in that plan are less than the $5,000 cap per person per year. And then once we finalize that with the individual and their family, then we would go ahead and contract with the technology vendor for that individual for the various technologies that they need, so that we can work on coordinating the implementation of that technology or service in that person's home. And that includes education about the technology, how to use it, how to set it up, and some troubleshooting. They'll have access to both us as the HES provider as well as the technology vendor if they have any issues with the technology during that period. So one of the things that we're going to have to do is ensure not only do we provide information about the home enabling support providers, but in addition to that, we're also planning to provide some background information and almost like a cheat sheet of the various technologies and services that we're going to be making available during the launch of this program. And then, as we add new technologies and services, we'll add to that guidance document to each of the CCOs and the care managers, so that you can have specific information about the technologies, the use cases for which when the technology can be helpful for an individual to support some of the various goals, and also language that can be used to justify the getting access to the technology that can be incorporated into a service authorization proposed, the plan, the SART plan, so that it can be uniform. It's not like we're trying to make it easier for care managers to have a standardized set of information, so that it's not dependent upon any given care manager's ability to join a webinar like this, that everyone's going to have the same level of information about all the various technologies, all the various services that are out there, so that they can use that to then incorporate into their workflows on the day-to-day, adding a new service and then submitting that to OPWDD. The last piece in the process for individuals. So this is these HES plans are on a 12-month cycle. So once they are completed and submitted to OPWDD through the Choices platform, the CCO care managers can then retrieve that information and incorporate that into a person's life plan about some of the specific services that were identified and agreed upon by the individual and the HES provider. And we have likely, at the 11th month of the year, the HES provider will do an annual review of the services and the technologies that an individual is getting to ensure that they're getting value out of that service, to ensure that things are working as expected, and whether they want to continue on for another year if things are working well, or if they think they want something, maybe there's new technologies that are available, or maybe they want to change it up because there's something else that they might want more than what they currently are getting. Then we can decide to do, if they want to change, then we can decide to do a new assessment at the beginning of the next 12-month period to then change the technologies and services that an individual receives. And then we would then, based on that new assessment, develop a new home enabling support plan, and then implement that for the following year. So that's kind of the cycle of how this is going to work from an individual's perspective, and then from the various other stakeholders involved. So I know there was a lot there, and there'll be an opportunity for folks to ask some questions at the end related to this and anything else. I think we can go to the next page. So contracting with vendors. So we've kind of touched upon some of this, but if you go to the next slide, you can see a snapshot of some of the various technology vendors that we've already started working on developing contracts with. And actually, in some cases, some of the HES providers already have contracts in place with some of these vendors. So they range, some of these, they range in the three categories that Tracy described before. There's the assistive technologies, there's the remote supports, and then there's the health access and coordination services. So there's those three categories. So we'll go through them kind of quickly, but at least to give you enough information about the types of technologies and services that we're planning to make available at launch. And again, we think that this is just the start, and we want to get further feedback from folks about what other technologies people want, that people have heard about, and then we can look into working on contracting with other technologies and technology vendors in the future. And there's a few others that are not on this list that we are working on trying to contract with that, we're maybe not as far along compared to the ones that are on this list. So the first one is Simply Home. And so they are a remote supports platform that, integrate both sensors and alerts that can promote safety and independence. And so they have a set of remote support professionals that are, they basically, you can use them in multiple ways, but essentially it can be, you can set it up and automate it to, alert when, at a specific point in time based on someone's routine or schedule, or it can be triggered based on, a sensor being triggered. So for instance, the example I like to use, there's a few different examples, so I can use a few others, but the one I like to use is a person supported maybe, pretty comfortable, pretty independent living at home, but they may get up in the middle of the night to go to the bathroom. And most of the time it's no big deal, not an issue, it's just normal. But one thing that you can do if you have any concerns is set up an alert system whereby you utilize a bed sensor so that when a person gets up in the middle of the night to go to the bathroom, it can alert either a family member or a caregiver or a remote support professional to check in on the individual if maybe they don't go back to their bed after 30 minutes. Typically they go to the bathroom and it's not a big deal. They come back after 5-10 minutes, but you can get an alert if they don't come back after a certain period of time. And so then you can check in on that individual and be like, is everything okay? Are there any issues? If not, maybe they just wanted to go watch some TV in the middle of the night or get a snack. And so it took them longer to go back to bed, but at least, you have an opportunity to check in to see if that happens. So that's one example of a type of alert that you can implement using Simply Home's remote supports platform. The next one is Station MD. Station MD is a virtual urgent care and behavioral health care service that is specifically tailored for people with intellectual and developmental disabilities. So they are staffed by population competent emergency department physicians that are trained and have expertise and experience working with people with intellectual and developmental disabilities. So they know our population, they know what the needs are, and they've been working with our population for a long time. Actually, we have been working at ADAPT with Station MD for people living in our certified residential programs for about 6 years now. And it's really great that now people that are living at home or in the community are going to now be able to get access to Station MD's services going forward. And there's a mechanism to help pay for that for people that want to access that going forward. So that's kind of exciting. And we think that technology, there's multiple justifications or use cases. It could be, great, obviously, for people with chronic conditions. Maybe they have diabetes or heart disease, and they may have, their blood sugar levels might get triggered, and so it's an opportunity for somebody to call Station MD to just check in on if this is just normal and what to do in that situation, or if it really requires them to go to the urgent care emergency room to deal with this situation. But it could also be a very good service for people that don't have chronic conditions, just to give an individual and their family members some peace of mind, so that they can feel that it's okay for them to be at home alone, because they have somebody as backup to for them to call if anything does go wrong from a medical perspective. So it is there could be multiple use cases, and that's part of the back and forth that we'll be doing as part of our assessment and recommendation process. Then there's the next one is Boundary Care. So that Boundary Care is an Apple Watch based application that could be set up to support and prevent falls, seizures, elopement. They have a bunch of different things, and so there's going to have to be a process of ensuring that the person sets it up for their specific needs. Like, for instance, if a person is at risk for elopement, they can opt to set it up so that can track, put a geofence around a certain area, so that if a person leaves that area, a family member or a caregiver can get an alert, so that they can check in on that individual to ask, is everything okay? Do you need anything? Are you just going around for a walk, or just wanted to make sure that you didn't, stray too far and not find that individual later. So it could be used for that, or it could also be used to predict, at an earlier stage if somebody's getting, a little lightheaded or woozy, and could prevent, falls, for instance. So that's something that it could be used for. So it depends on the individual's needs, but that could be another support. And that one is not technically a remote support platform. It's just considered a assistive technology, but it has some features that kind of skirt that area between remote supports and assistive technology. The next technology is Lotus's Lotus Ring. And so I think the founder or the COO might be on the call right now. But so Lotus is very cool and interesting technology. It hasn't been around for that long, maybe about a year, but it's a new ring-based technology that utilizes the infrared sensor that you may have in your own home, in your own TV remote control. And so it's utilizes a pretty seemingly old technology, but to do really cool new things for people that could really benefit from that. And the way it works is that it's a ring that has a button on it, and it connects to light switch covers that can be added to any old light switch in a person's home. And it's basically plug and play. It attaches using magnets. And it's we've actually did a pilot with Lotus last year where we tested it out on about 15 to 20 people in our residential programs, and it was very, very well received. And there was a lot of the people we support, as well as staff, really loved the opportunity to be able to not have to a lot of our staff didn't have to turn on and off a light switch for a person supported. They can turn it on and off on their own. And it can also be used to turn on and off TV. And so that's something that it's a technology that doesn't have to connect to the internet. There's no application related to it. It's really just plug and play. You charge it for a few minutes. It can last for a long time, and it's really plug and play. And it's one of those that we did a couple of presentations over the last few months where we showcased the benefits of the technology based on our pilot that we did with Lotus. And there was a lot of interest for this technology because it's so easy to use and figure out. So that's something else that's coming down the pike and will be available for people through this program. The next couple of items, Dose Health and Improve on Health, they both offer different types of medication management dispensers. On the Dose Health side, it's a little bit, I guess, quote, simpler in that it's a small device that's portable. It has a battery in it, and they also offer some personal emergency response system devices as well. So those are a little bit more updated versions of the old. I've fallen and I can't get up, those commercials. And where they have, you can press a button, or they have a watch-based PERS device. But the smart medication dispenser is their biggest product. Improve on Health, they also have a medication management device, but it's a little bit, it's catered towards a slightly different population. So, like I said, we'll be providing a little bit more information about all of these technologies in a standardized way to the care managers, so that you have that information and can, speak to it with the individual and their families when you have those conversations. If you go to the next slide, there's a few more technology vendors that you can touch upon. So there's Riften, and Riften makes adaptive equipment. They have chairs, standers, desks, toilet seats. A bunch of their devices are not covered under this home enabling support service because they're considered durable medical equipment, or at least a subset of, there's a category of DME that they're considered. But there are a couple of different devices that they do offer that we are looking to make available during this service. And one of those is an adaptive tricycle. So it's, for people whose goals may be to, get more fit or to be more active, it can be an opportunity for an individual to get access to an adaptive tricycle to help them, towards that goal of being more active. They also offer a couple other technologies that we're looking to make available through this program. Inclusion Table, they're a relatively new company that has developed a table that has, it's a circular table, but has 4 sides, and can, each side can go up and down independently of the other. So people that are in wheelchairs and that, are in different types of wheelchairs, or that, are just sitting at regular chairs, can sit together at the same table and feel like they're included with everyone else. So that could also be something that, for the right person and the right goals to try to, support that inclusivity, could be something that we can offer to people in the right setting. And then the last one on the initial list is Look, Cook, and Eat. So that is a meal preparation and cooking tutorial service that is specifically tailored for people with IDD. So it's a company that, has developed all of these, very thoughtful recipes and instructional videos to support people to learn how to cook and support them as they, develop that skill set. So those are some of the initial technologies and services that we're looking to make available at the start of this program. But I know that, we're already getting questions about, certain like home automation devices that people are interested in and want to get, or communication technology. So we're trying to gather that feedback to try to inform and support us in kind of thinking about which new technologies should we focus on adding to this list as we go forward into the program. So I think you can go to the next slide. So the implementation status. So if you go to the next slide, so right now, Adapt, at least I'll speak for Adapt and kind of touch upon some of the other 7 HES providers. So Adapt at the moment, so we are still in the process of implementing a number of these different pieces to be able to, accept referrals from care managers and to, do the assessments and to match them up with technology and to bill for the service. So we're kind of in the process over this next month and a half to kind of get ourselves ready, set up, get the staff in place, get them trained, get comfortable with all the processes internally. So we think that we should be able to start accepting referrals from CCOs probably sometime in June. That's our current goal based on everything that we know we need to do internally. In the meantime, we are working with obviously all the technology vendors to contract for their technologies and services for this program, and that's been going on for quite some time. But the one good thing is that we've been trying to do this in a very coordinated and structured way with all 8 HES providers together, so that everybody in New York State, whether you live in Buffalo or if you live in Long Island, everyone is going to have access to the same technology or services, at least at the start of the program. So that's something that we've been trying to coordinate and organize and trying to make it easier for everybody. The other thing is we have been working with each of the CCOs to align on the processes and the referral process specifically. And so that's something that I know I touched upon, and that's something that we're going to continue to do and refine that. And one of the things that we'll send out, and I know Tracy mentioned this, is we're going to be sending out a contact list for all 8 HES providers, so you have information on the HES providers in your geography, and to do any outreach and develop relationships and to ask any questions, both right now before the program is, I know the state has already, quote, launched the program. It's just that us HES providers may not be ready to accept the referrals at the moment. But I know that's one thing that we'll touch upon later, but I think there is an opportunity for HES providers to develop relationships with each of the CCOs, so that we have this back and forth relationship to collect, disseminate feedback, and also provide education and guidance as we're kind of developing our own protocols internally. We're also working on coordinating with all the other stakeholders, including providers, fiscal intermediaries, and individuals and families. We want to make sure that we're going out and doing presentations just like this with all of the other groups that are out there, so that they know about this new service, understand what the benefits could be for them and how to access it. We're also looking at trying to be supportive of facilitating the relationship between the fiscal intermediaries and the CCOs, and the providers and the CCOs, and the individuals and the CCOs, so that they understand how to access the new service. And then the other thing we're looking to do is, so at least at ADAPT, we are in the process of establishing a smart lab in one of our homes on our campus in the Bronx, where we're going to be able to showcase all the various technologies that we're going to be making available for home enabling supports, and other technologies that may not be available through home enabling supports, is just for people to learn about what's out there. So people can learn about it, try it out, test it out, and then be a resource for people to kind of learn more. I think we're also going to be once that new smart lab is established and is open, we're planning on doing regular events, so that we can invite different groups to come learn about the different tech, but also invite technology vendors to do demonstrations of their technology, and also be able to interface with individuals, people supported, care managers, and others, so that they can get that direct feedback, so that can hopefully inform new opportunities or technologies that they develop in the future. So we think that that's a great opportunity that we're going to hopefully make available and continue to iterate on as we go forward. And then with the individuals and families, same thing. We want to go out there, spread the awareness of this program, and offer opportunities for folks to learn more, even before they get access to the technology themselves, but just to learn about what's out there, what does this mean, how does it work, all of that good stuff. So I think we can go on to the final couple of slides. So the next steps and key takeaways. So we can go to the next slide. So as I said, we're working towards launching this new service over the next couple months. I think most of the other HES providers are in the similar position as we are, kind of working on getting themselves set up internally, getting their billing systems and processes all squared away. There might be a couple of HES providers that might be a little ahead of the curve and might be ready a little sooner, maybe in the next month or so. So I do know that for anybody that is in kind of the central Western geography, the one HES provider in Region 1, ARC of Chemung and Schuyler County, they're a little bit ahead of the curve and may be able to accept referrals a little sooner than some of the rest of us. So that might be an opportunity for those folks. We've gotten this question a lot from CCOs. Even last week, I was at an Alliance conference where OPWDD gave a presentation on home enabling supports, and there were some questions from some of the care managers in the room about what should CCO care managers do right now, given the fact that most of the HES providers may not be ready to accept referrals. My thinking is that given that the process for the state to approve new service authorizations could take a long time, there could be a good opportunity to use this period to get people that are really interested in getting access to home enabling support services and technologies through that life planning process and service authorization process. And it's better to do that now than having to wait 2 months, and there's a longer queue, and so it takes longer for somebody to get access to the assessments, because they're not eligible for the assessment yet because their service hasn't been authorized yet. So we're recommending that CCOs go through that life planning process now. If they've already had the conversation, the individual's ready, they're interested, and could benefit from that, and then at least they'll be that much closer towards the assessment and the approval process, at least with the technology piece of it that is in the control of the HES providers. That's what we've been saying. The other thing we're saying is the CCOs, the fiscal intermediaries, individuals, and families, if you have any questions on this new program, if you want to understand more, if you have recommendations on technologies that you want to be able to access through this new service, please reach out to your HES provider in your region so that you can have that conversation and provide that feedback, because that's what we want. We want this to be a back and forth. We don't want to be telling you what you need. We want you to tell us what people want, so that we can work on making that available going forward. And we think this is just, again, the beginning of the process. This is a new opportunity that we're all kind of learning together, and we want this to be a successful new service. We want people to really benefit and get some value out of it. So we want to make this as successful as we can. And so that's why we were trying to be thoughtful and be steady about what we're doing up front to ensure that there's, we set the expectations and, we address as many issues as we can up front so that it makes it a little less frustrating and a little bit more streamlined for people that are actually going through the process. And like I said, we're going to continue to do these presentations and, provide that guidance and clarity to all stakeholders over the next few months, even after the program is launched, because we want this, to be successful. We want people to know about it. We want people to access the services. And, we think this is, a great opportunity for people living at home or in the community. And we hope that in the future, it expands to people living in certified residential settings as well, so that they can also access these really great, valuable, beneficial technologies and services to support their needs. So I think that's pretty much everything. I think the next slide is questions. So we can open up.
Several already in the chat, so we can start there and feel free to add. The first question is, can you apply for several items as once as long as the total is under $5,000? The answer is yes. How long do you expect the process to take? I mean, I think because it's a new service, we don't know entirely how long. I think we expect we're saying several months, but it could be faster or slower depending on what actually happens once it gets up and going. The next question, since remote supports are limited to ages 15 and up, then what could assist a family with a 5-year-old that tends to open the front door? Ronick, do you want to take that one?
Yeah, I mean, there could be a few different options for that. Off the top of my head, I guess it's probably going to be very specific and nuanced for that specific individual to figure out, is it a challenge that they, you can't lock the door because they know how to open the lock more easily? Is it, you want to get alerted when they open the door? So I think, it might be person specific, but, we can absolutely, have that conversation and kind of brainstorm around what could be a beneficial solution to address that particular need, because it may not be just that person that could benefit from that. I think that's the goal for us. We want to see what kind of, technologies that people are interested in, and see if there's, residents across not just, one geographic area, but across the state, so that we can work on connecting with various technology companies that may offer something that could be benefit to many people.
Okay. Next question, is the participant required to use vendors you partner with for technology purposes, or can they use other vendors as well? So, yeah, go ahead.
Yeah, so for the moment, so the way it works is that we do have to the HES provider does have to contract with the vendor to offer the technology or service. There may be, and that's kind of why we're trying to be, we're trying to set it up in a very thoughtful way, because we want to make sure that there is responsibility by the technology vendor to offer support, troubleshooting. If let's say the product breaks, and who's responsible for covering the cost of that. So that's something that we've incorporated into the contracts that we have with the technology vendors that we are making available through this service. And so, we're not just making, anything and everything available, because then it's going to be hard to coordinate and navigate and administer this service. So that's why we're trying to be thoughtful and methodical, and trying to make sure that we are trying to do the best we can, and also not make it too administratively burdensome for our staff, because we know that they're going to be responsible for doing a lot of the coordination and connections with all these technology vendors for the implementation and ongoing troubleshooting.
The next question, which is a hot topic, is the application process the same if a member uses self-direction? If not, please explain how to apply it if the member has self-direction.
This is a great question. So I was going to touch upon this, but I'm glad I got the question. So there are a lot of questions coming from FIs related to how to handle people that are in self-direction. And so last week, a lot of questions came to OPWDD directly. And so they have mentioned to me and some of the other HES providers that they will be coming out with additional guidance. They've already come out with some guidance for folks in self-direction, but they're going to be coming out with additional guidance over the next few weeks to provide more clarity as to how the process works, and for people that are in self-direction and their fiscal intermediaries, specifically around how to budget for some of these services, how to ensure that it's in the right line item. There's specific questions around if the individual wants to get additional services and it's above the $5,000 threshold, can they use their OTPS part of the budget to pay for it? And so there's going to be I'm sure there's going to be questions and some specific clarity around some of those questions. But if there's any specific questions that any of the care managers have that they're getting from fiscal intermediaries, or they have themselves, please reach out to us and any of the other HES providers. We're trying to compile that information to be able to then get standardized answers from OPWDD about how to deal with some of those situations.
And I also you can feel free to reach out to me. I just put my email in the chat. I see Muse, yep, you have your hand up. You're muted, so just if you unmute yourself.
I just sent a request to unmute, so that might help.
Sorry, you're still muted. No, you're not able to. She put in the chat she's not able to unmute herself. Do you want to? Can you send another request? Kate, maybe it disappeared. We're gonna send you another request that should allow you to unmute yourself.
Yeah, it doesn't look like it wants to unmute.
Okay. So the choices are either you can put your question in the chat, you could email me. Okay, so you can either put your question in the chat, you can reach out to me afterwards, and I'm happy to answer the question. Sorry that you're unable to ask it live at this point. Okay. Great. Are there any other, we've gone through all the questions that were put in the chat. Is there anybody else that has any like lingering thoughts or questions that they want to ask before we wrap up? I don't see any other hands raised or any other question. Email. Okay, great. Thank you. Yep, feel free to email. All right, that's it on our end. There's going to be much more information to come. And so, we will share with you all information as we get it. But again, you can feel free to reach out to me if you have any questions. And, we will be providing a contact list for the various regions. So you can reach out to those agencies as well.
All right,
Everyone.
Thanks for joining us and have a great day.